We're going to go over what should be taught about asthma at every opportunity with the patient. We should always give them a basic definition of asthma and keep it in a way that they can understand what you're talking about. So you could say that asthma is a chronic lung disease. The airways in the lungs are very sensitive, and when they become inflamed and narrow, breathing becomes difficult. You'll want to go over the causes, which a lot of people are curious of what causes asthma, and they need to know that there is not a known cause for asthma, but it has been linked to genetics and environmental factors. We need to educate them on the role of medications and let them know that there are two different kinds of medications. There's a quick-acting medication that's usually used in emergency situation to quickly open up the airways to provide relief of shortness of breath and wheezing. And there are long-term control medications that are used daily to maintain the control of asthma symptoms to avoid worsening. We also need to go over patient skills with them and instruct them on proper inhaler technique and device operation when they're taking their medications. And we need to teach the patients proper technique and then have them demonstrate it back to you. I have listed some common therapeutic issues with these different types of devices and inhalers that are usually seen in patients, along with the populations that they're given to. So a meter dose inhaler, the MDI, is good for all ages, but if they're less than 5 years old, they will need a spacer. The most common therapeutic issues with them is the coordination of accusation and the slow inhale. So they'll have to actuate it at the same time that they're slowly inhaling it. Now, if they have a spacer, it becomes a little easier because you don't have to coordinate the accusation and the slow inhale. But then there comes in the difficulty of a tight seal with the spacers so that they're not losing, so they're getting in all the medication from the spacer. The breath actuated MDI is for 5 years and older. Some issues with that is coordination, again, of the actuation and inhale, and difficulty forming the seal around the mouthpiece, and it cannot be used with the spacer. So kids less than 5 can't use it. The dry powder inhaler, the DPI, is for 4 years old and older. Some issues with that is the dose is lost if the patient exhales through the device. So whenever they inhale, they're supposed to take the mouthpiece out of their mouth and hold their breath. Some people like to blow back into the inhaler and it just loses most of their medication. Difficulty taking a slow inhale as well. Some people like to inhale it super fast and it just sticks to the back of their throat instead of getting into their lungs. And remembering to wash and spit after their inhaler. The next device is the small volume nebulizer, and that's for all ages as well. Problems with that is it's more expensive and it's time consuming. It generally takes about 5 to 7 minutes to get through a nebulizer, whereas it just takes a few seconds to a minute to do an inhaler. So it takes a little bit more time and it has more potential for bacterial infections if it's not cleaned properly. Some more patient skills is identifying and avoiding environmental exposures. They need to be aware of the environmental exposures that triggers their asthma, and they need to try to avoid those if possible. Self-monitoring, they need to be aware of their symptoms and they need to know when they are worsening so that they know to get to their quick-acting inhaler or get to the emergency room. And they need to develop and review an action plan. I have an example of an action plan. More action plans can be found in the link at the bottom of the slide. But this basically just gives the physician name and information, the patient's name and information, the medications that they're on and how they take it, And it gives kind of a chart here that tells you where they're at with their symptoms. If they're in the green zone, they're good, they can breathe, they can feel like they can breathe, they can walk around without feeling exerted, and it just kind of gets worse as you go down. And it gives you a real good layout of the symptoms that they might be feeling at that time. And there's a part on the right for them to give an instruction to whoever is around them to give them a certain medication at that time should they be feeling that way. So these are real helpful for patients, and there's also a child one for patients under the age of 5 on that website as well.